Hello there and welcome back. So today's short video is going to be about feeding techniques and burping your baby. So a lot of parents in the hospital say that, when they send their baby with the nurse for a few hours or overnight, that they're surprised that the baby eats much more with the nurse. And it's not so much that the nurse is quote unquote better at feeding the baby, it's just that we have different techniques that we employ. So one of the main techniques is making sure that the baby is nice and alert and making sure that the stomach is ready to receive the milk, whether it's the breast milk or the formula. So typically what I personally would do is when it's time for the baby to eat, change the diaper first. Just like us, we wouldn't want to eat if we were dirty. I change the diaper first to make sure that the baby is nice and clean and comfortable, but also the cold wipe helps to wake the baby up. After that, I usually will check to see if the baby needs to burp. So I'll try to burp for maybe about 30 seconds to a minute just to see if there's any extra air in there, because we want to remove all of that before we try to start filling up the stomach with milk. So once we've changed the diaper, burped the baby, gotten the baby back comfortable, wrapped in a blanket or in the onesie that the parents have chosen, then we will work on introducing the nipple into the baby's mouth. So we don't do any of the things that will make the baby cry and or fussy during or immediately after feeding. We want to take care of all of that beforehand so that the baby is nice and calm during the eating. So sometimes we employ what's also called chin support, which is when you put the nipple into the baby's mouth, but then you also use 1 to 2 fingers underneath the baby's chin to kind of help keep that chin up to create a nice seal around the nipple. That way the baby feels the nipple up against the roof of the mouth. So when you insert the bottle into the baby's mouth, you always want to go where the nipple is at an upward angle, so that as you're sliding the nipple to the back of the mouth, that nipple is grazing along the roof of the mouth and the baby can feel it, and then kind of sends off some sensory alarms in the baby's mind and says, oh, okay, yeah, it's time to start sucking on something. There's something in my mouth. A lot of times if the baby doesn't feel what's in their mouth, they won't start sucking. So we always want to make sure that the nipple is up against the roof of the mouth as much as possible, without causing discomfort on the gums at the edge of the mouth. So burp, feed, burp, feed. That's usually what we do. So if your baby is drinking 1 ounce, which is typical, especially for a newborn baby, we typically will try to burp at the 1/2 ounce mark. So any of that air that gets collected in their stomach as they're suckling down the milk, we want to get that back out before we can say, yes, they're full. And a lot of times that's what tends to happen when the nurses feed the baby in comparison to when the parents feed the baby. The nurses typically will feed the baby and burp a little bit more frequently instead of just waiting until the very end to burp. So we'll feed about 1/2 ounce, burp, feed some more, burp again, and then kind of see if the baby is receptive to taking in more or if they're pretty much done for the time being. So when it comes to different positioning, most of the time you are going to feed the baby in an upright position. Sometimes, especially during the cases of NICU babies, we may feed the baby in what's called a side lying position. And that's typically where, like it sounds, we lay the baby on their side with their head still inclined more than their buttocks. So you don't want to have them completely flat, and you don't want the head to be lower than the feet, because that would lead to, choking, aspiration, and reflux. So we lay the baby on the side, introduce the nipple into the mouth, and then that way they can control a little bit better how much they suck at a time versus how much they're swallowing at a time. So these are all tips that we use in the nursery and or the NICU to help feed your baby, to make sure that they are actually eating what they want to eat and help them to last the 3 to 4 hours in between feedings. If you notice that your baby's waking up more often than that 3 hours, that's usually because they haven't really gotten full. Hope it helps somebody. If you learned something, I've done my job. Thank you. Bye.